public assistance. You can see on the left that DCD is no exception to that. 95% of the planned spending in the division goes to that, and that's why we'll be looking at those programs like child care subsidy. That's where the bulk of that comes from. 3% personal services, that's the staff, the workforce at the division, and 2% other. $1.1 billion, where does that come from? What funds that? The chart on the right shows, again, similar to the division or to the department as a whole, you can see that DCD gets the bulk of its funding from federal funds, 62%. So the biggest contributors to that would be the Child Care and Development Block Grant, as well as Temporary Assistance for Needy Families, or TANF Block Grant. 30% comes from net general fund appropriations, and a chunk for the NC Pre-K program comes from the North Carolina Education Lottery. And also I've noted on the bottom, we typically will try to give you the FTE number for the division. 349 FTEs in the Division of Child Development and Early Education currently has about a 17% vacancy rate, so a bit lower than state government as a whole. Again, breaking down the planned expenditures for this year. So this is broken down by program, and you can see here the division does a wide range of things. I'm focusing today on child care subsidy, NC Pre-K, and Smart Start, simply because that's where the bulk of the budget is. This is Appropriations Committee, so that's what we're going to focus on. The division does do other things. We'll have a slide on that later. But over half of the division's budget is the child care subsidy program, over $600 million this year. You can see nearly a fifth in NC Pre-K, $215 million, and Smart Start at 15%, $166 million. And I'll note that typically the other slice is actually even smaller. For the current year, you have some child care stabilization grant funding that is non-recurring in there. So it's even more it may be dominated by those three programs normally. So next we'll start with child care subsidy, looking at these, a couple of the programs here. So the child care subsidy system in North Carolina, this is locally administered. People will go to their local DSS office to apply for child care subsidy. It's state supervised, and that's the division's role here. So eligible families can receive financial assistance for childcare. A snapshot of the program in December shows that over 57,000 children were served with a wait list of just under 11,000. So who's eligible for this program? For a family to qualify, they have to meet situational and financial criteria. So first, situational. I won't read each bullet point to you. You can see there's a number here. The first bullet point, working, is how the vast majority of people that are participating in the program qualify. Last time I heard it was in the high 80%, so the vast majority are working. People can also be in school, or their child may require care for child protective services or welfare services, or have a qualifying developmental need. Financial eligibility, the family income has to be below the threshold. And what that is, that changes each year based on federal poverty levels. So if the child is aged 5 or under or has special needs, the household income, maximum household income, is 200% of the federal poverty level. And what that looks like, just as an example, for a family of 4 is $5,200 per month, maximum gross household income. If a child is age 6 to 12, or we may call a school-age child, that is our example family for 133% of federal poverty level is $3,458 per month. And one note on the income eligibility, families are responsible for a copay that's currently set in law at 10% of their gross household income. Fairly recently, the federal government changed the maximum that states can charge to 7%, so that'll be something to look at during the long session for the General Assembly. The providers of these services, child care subsidy providers, receive a reimbursement rate for each child that they serve. Those reimbursement rates, I can't throw up $1 amount on the screen for you. They vary based on a number of variables. whether the child receives care in a child care center or a family child care home, what the star rating is of that facility, and we'll go more into star ratings in a moment, how old the child is, and what county they're receiving care in. So there are hundreds, probably thousands actually, of different child care subsidy reimbursement rates. The rates are based on a market rate study, and so that's taken every couple years. That involves surveying all of the child care providers in North Carolina, asking them what they charge families for child care services. Would see those, in theory, you would take those rates for each category. So say a 2-year-old in a particular county receiving care in all the 5-star facilities, all the 5-star centers, you would list those, and the 75th percentile, 75th highest, is what the federal government recommends we establish as the reimbursement rate for each category. And the current rates were last updated effective October 1st, 2023. And I'll talk more about the funding for that in a few moments, but that was based on the 2021 market rate study survey done in late 2021. I mentioned star rating. So what that looks like in North Carolina is the Quality Rating Improvement System, QRIS. Scale is from 1 to 5 stars, and a note for the child care subsidy program is providers must be rated at least 3 stars to participate in the program and provide service. So programs currently earn stars, and I say currently because this is changing right now, but how it's currently done, they earn their stars based on the staff education and also program standards. The exemptions to the QRIS rated system are facilities that operate under a notice of compliance under General Statute 110-106. Those are religious sponsored facilities. So they still need to follow basic health and safety guidelines, but they can opt out of the QRIS rated system. And this is also an exception to the 3 stars required to participate. These notice of compliance facilities can participate in the child care subsidy program. Now, I mentioned that this is changing, so QRIS modernization, we'll call this. 2 relevant pieces of legislation in 2023, the General Assembly told the Child Care Commission to recommend updates and changes to the QRIS system, and they brought those in 2024, and the second piece of legislation there is authorizing the Division of Child Development and Early Education and the Commission to implement those. So currently those new standards are going through the rulemaking process, so nothing is finalized yet, but it's in the process. And there's 3 different pathways or options that programs could demonstrate their quality here. Program assessment is probably most similar to the way that it was previously done or currently rated. Classroom and instructional quality, and also accreditation, where programs that, like for example Montessori, can achieve a particular star rating automatically because the standards for those programs are similar to the QRIS system. Funding sources for the program. So I mentioned this is the largest single program in the division, over $600 million in the current fiscal year. Most of that comes from federal funds. You can see the child care block grant at over 50%, so over $300 million we are using for this program. That's the largest contributor to the budget, and that federal program comes with a number of rules and regulations that really kind of shape how the program is administered here in North Carolina. Net general fund appropriation over 1/5 of the budget at 21%, and the temporary assistance for needy families block grant, another federal funding source at 20%, comprises the inputs to the budget. So that's child care subsidy. The next program we'll look at is NC Pre-K, previously called More at 4. NC Pre-K is the state's public pre-kindergarten program. So child care subsidy, we said, is for ages really 0 to 12 or special needs. NC Pre-K is for 4-year-olds and only for 4-year-olds. The point of this program is to help those 4-year-olds be ready to enter kindergarten the next year. So the program goes for 10 months, at least 6.5 hours per day. The max class size can be 20, and you would have a couple staff in there with a 1 to 10 staff to child ratio. There are licensing requirements for the teachers, and providers have to be rated at least 4 stars on the QRIS system. There is income eligibility threshold, just like child care subsidy for NC Pre-K. Family income must be at or below 75% of state median income. So again, our example family of 4, that equates to just under $6,600 per month in gross household income. Also outside of income eligibility, children of eligible military families are eligible, and children who have additional risk factors. You can have in a county or a NC Pre-K region up to 20% served if they're not income eligible. And you can see here the categories that would qualify a child under that area. I'll give you a snapshot of the program in the current program year, 24-25. Over 28,000 students served at over 1,100 sites, over 2,000 classrooms. So as you can see, a lot of times a site will offer multiple NC Pre-K classrooms. Contractors here, so a contractor is who in a county, or if a couple counties have banded together for a NC Pre-K region, this is who kind of administers the program in that area. They'll sign up providers, things like that. It's typically the local partnership for children, so the Smart Start partnership, or the public school. There are 2 counties that have the Head Start, which is a federal program, as their contractor. I mentioned over 28,000 NC Pre-K students. So where do they go each day? Where do they receive NC Pre-K services? 51% are at public schools, the largest single contributor. 37% would go to a child care center, a daycare that would have an NC Pre-K classroom or multiple NC Pre-K classrooms. And the remainder, 12%, would receive those services at a Head Start facility. And as I mentioned, that is a fully federal program, but that's where the students are receiving services each day. Reimbursement rates for NC Pre-K, a little simpler than the child care subsidy program. Doesn't differ based on region or county. The only differentiating factor is where the children would receive their care, the facility type. Private child care receives $719 per month, and that's per month per child. For providing NC Pre-K. Public schools at $496, Head Start facilities at $420. Funding sources for this program. So again, significant funding sources, federal receipts, but not to the same level as the child care subsidy program. So the largest contributor here is around $78 million from the North Carolina Education Lottery receipts. Next is TANF block grant, which we've mentioned before, a federal block grant, and then net general fund appropriations, over $47 million each year from the general fund go to the NC Pre-K program. And the other 10% is similarly mostly federal funds, so around 40% federal funds for this program. Next, I'll touch on Smart Start. So Smart Start, a little different than the child care subsidy or NC Pre-K program. This is a public-private partnership, and you may be familiar with the Smart Start partnership in your district. There are 75 of them, often serving an entire county, and sometimes counties have banded together to kind of create a region, have one local partnership serving multiple counties. So we have 75 in the state. And they'll provide a wide array of services to families, to child care providers, in their area. They are administered at the state level by the North Carolina Partnership for Children, NCPC, here in Raleigh. So they'll coordinate, they'll help those local programs follow state and federal laws and guidelines, help them with training, collect data, help them choose evidence-based programs to provide to the people in their counties, in their areas. The current year's budget for Smart Start, for all these different initiatives, $166 million. And the vast majority of this comes from state appropriations, so net general fund appropriations. So that's one way that it differs from NC pre-K and childcare subsidy, which are primarily receipt funded. The vast majority of Smart Start's budget comes from the general fund. To give you an example of Smart Start programs, again, I can't put them all up on the screen. There are many, and counties generally have leeway to choose they want to invest their funds in a particular program or initiative. A neighboring county may choose to do different things and not have as much focus on that. Other things they feel are more important. But just to give you an idea, childcare subsidy, again, probably the largest single area here in the budget. That's around $71 million of their total budget in the current fiscal year. They will work with childcare programs in their counties, help them maintain their quality of care. They may provide technical assistance, help them if someone is interested in opening or in raising their star rating. They will provide family support, so things, an example of that could be a nurse visiting a home of an expectant first-time parents. Early literacy, the example here is Dolly Parton Imagination Library, where children receive books in the mail until they're 5. And early education quality, so again, kind of working with the childcare providers in their area. An example here is continuing education scholarships. I do want to touch on the other responsibilities of the division. These are important. This is Appropriations Committee, so I'm focusing on where the bulk of the budget is. These other responsibilities only take up around 8% of the budget, but I'll note that I mentioned there's 349 FTEs at the division. The majority of them, over 200, are actually in childcare regulation. So these are the people who are going out to childcare providers all across the state, are visiting them, often unannounced, ensuring that health and safety guidelines, everything's being followed and that children are safe. There's also childcare capacity building, which is mostly funded by the Child Care and Development Block Grant, federal block grant that I mentioned. This is to help the state increase the quality of childcare, so it doesn't go towards direct services, but increasing capacity and quality of childcare in North Carolina. Criminal records checks. This unit provides criminal record checks for everyone in DHHS, so people that are hired to DHHS, adoptive parents, foster care parents, people who are hired to work at a mental health facility. They all get their criminal records checks through this unit at DCDE, and as well as the division's administration. And there are other units that have kind of included in larger categories here, for example, that may work with education standards for the NC pre-K teachers, helping them navigate that. The vast majority of the funding for these areas, like 95%, comes from mostly federal funds. There are some licensing fees in the regulation space, but the vast majority is from federal funds. Now we'll touch on child care stabilization grants next. So this is something you may be familiar with. It's been in the news and been discussed for the last couple of years, but I'll give you a brief background quickly. So child care stabilization grants, they were initially funded through the American Rescue Plan Act, and that was a federal act in 2021. The state received $800 million specifically for child care stabilization grants. And so the division administered these grants. They did this through two different types of grants, two different types of stabilization grants for child care providers. The first, fixed cost and families grants, and these could be used by providers for a wide array of things, a lot of things that you would go through as a child care provider that are typically you spend money on most things other than kind of capital, like large scale renovations or building. The amount that the providers received, it was based on a formula including things like the capacity, so the size of the child care facility. So as I'll note in later slides, this grant is discontinued, hasn't been continuing on for a long time. So I'm going to focus on the next one, that's compensation supports grants, which is continuing on now. These grants can be used by providers. It's really for the workforce, for compensation for their staff. There were a couple different options for them: bonuses, increased base wages or benefits, the amount that providers received depended on the number of full or part-time staff that they have working at their facility, how they chose to use the funds from the options above, and the star rating of the facility. A couple noteworthy dates here. So November 2021, that was the first installment of the grant. So the funds were first provided in 2021. Late 2021, they began going out. January 2023, so 5 quarters later, these were provided on a quarterly basis. That was the final installment of the fixed cost grants. That was the first type of grant mentioned on the last slide. At this point, all of that $800 million that was provided through ARPA was fully expended. And that was January 2023. Now, in ARPA, there were other one-time COVID relief funds for childcare in general. They weren't specifically designated for stabilization grants, but they were provided to the state for childcare, stabilizing the childcare industry in general. And so the compensation grants were continued on with those funds. So January 2023, the initial tranche of 800 was fully spent. Next noteworthy date is April 2024. That's when the rest was fully spent. The other childcare ARPA COVID relief funds were spent. September 2024, so this was just last year, the compensation grants were provided at a reduced rate around 75% of what they had previously been provided at. And for the first time, state funds were used, not entirely. It was a combination of some federal funds, but for the first time, state funds were a source for these compensation grants. February 2025, so the last scheduled, last funded installment of these compensation grants either has gone out or is in the process of going out this current month. So that is for the current quarter, the third quarter of the current fiscal year, so January through the end of March. And as of December 2024, so this is all of the stabilization grants have been provided except for that last installment. This isn't updated for the February installment, but over $1.16 billion has been paid directly to childcare providers across the state. And I've broken this up by the type of grant. So $592 million fixed cost grants. Again, if you recall, all of that was federally funded. Compensation grants, which is the type that is still ongoing this current quarter, $569 million. The majority of that, federal funds, $43 million in net general fund appropriation. The current quarter is fully funded by the net general fund appropriation. I'll review some significant budget actions for the division from the 2023-2025 fiscal biennium. We just talked about childcare stabilization grants, so I'll do that first. So 2 pieces of legislation last year in 2024. First, Session Law 2024-40. This provided $67.5 million for 2 quarters of the compensation grants. So this would have represented July 2024 through the end of December 2024, 2 quarters at a reduced rate, like I mentioned before, around 75% of what had previously been provided for these grants. And Session Law 2024-57, late last year, provided $33.75 million for 1 quarter, and that is the quarter we're currently in, January to March 2025, and to extend the compensation grants again at the same reduced level. And the note here is that this was fully funded through net general fund appropriation. Now on to non-stabilization grant programs and areas. The first is, think back to the child care subsidy portion of the presentation. We talked about the provider reimbursement rates. And so I mentioned that they were last updated in October 2023. So this is how they were funded in that legislation added $32 million recurring in the first fiscal year of the biennium, $43 million recurring in the second fiscal year, which we're in right now. And that was to increase the reimbursement rates for providers. So that was based on the 2021 market rate study and brought everything up to the recommended rates from that market rate study. The 2023 Appropriations Act also included a couple areas of non-recurring funding, 2 pilot programs and funds for the Dolly Parton Imagination Library. And the second Disaster Recovery Act of 2024, late last year, also provided $10 million non-recurring for childcare providers who had been affected by Hurricane Helene. And those funds go through NCPC, the Smart Start partnerships. Last slide I want to touch on are budget issues, really potential decision points for the General Assembly that will likely come up this year, things to think on. First one is childcare stabilization grants. As we mentioned before, the current quarter is the last scheduled quarter, January through March, and those funds are non-recurring. So both for the current fiscal year and for next fiscal year, that's a decision point for the General Assembly. Next is the childcare subsidy family copay. So I had a note on an earlier slide. You may recall that families are responsible for 10% copay of childcare subsidy, 10% of their gross household income. The federal government recently changed that maximum that a state can offer to 7%. So a couple decision points here. One would be the 10% is set in law. So whether to change the 10% down to 7 or lower, and 2 would be how that would affect the program's budget. Moving that down means the state pays a slightly higher share of each subsidy voucher. So would put a little bit of pressure on the wait list. So just a decision point on how that will be treated. And the last one, just in general, is the NC Pre-K and Child Care Subsidy 2 programs, the reimbursement rates for providers. One note here, there has been a new market rate study that was released that has new proposed market rates, reimbursement rates for providers late last year in the child care subsidy area. So just, again, another decision point, things that you may hear talked about here in the long session. And Madam Chair, that concludes my presentation.
Thank you so much. That was very interesting. I know we all look forward to some lively discussion and interesting questions on this topic. It's very timely. We'll do that after we have the presentation by Susie Camilleri. She would come to the podium to talk about the Office of Rural Health. While she comes forward, I think I might have skipped over our house pages. Do we have house pages with us today? We do. Well, I'm so happy y'all are here. It's Anaya Hamilton. Where are you from, Anaya? Awesome. And you're sponsored by Speaker Hall, I believe, as is Brandon Moreno. Welcome, Brandon. Where are you from? Well, welcome. We're happy to have y'all here, and I'm sorry that I glossed over that earlier. Our Senate pages, I think, went home yesterday, and I didn't realize we had pages in the building. So we are happy that y'all are here, and I hope that you have had a good week, and it's been useful and instructive. So you may proceed when you are ready.
Thank you, Madam Chair. Good morning, members and chairs. My name is Susie Camilleri, and I am going to talk about the Office of Rural Health budget and programs this morning with you. Today's presentation and all of my future presentations that I'll be giving next week will follow this outline, and we'll touch on the authorizing laws and responsibilities of the office, give an overview of their budget, an overview of select programs, and then we'll highlight some recent legislative actions. So we'll begin with the division's authorizing laws and responsibilities. I'll just note that I'll only be touching on key statutes and laws affecting the divisions that I cover. Won't be providing comprehensive lists of statutes. For some background, the Office of Rural Health was established in 1973 and is the oldest office of rural health, state office of rural health in the country. It was originally placed under the Department of Human Services, but in a reorganization in 1997, it was moved under the newly established Department of Health and Human Services under Chapter 143B. It is administratively housed under the Division of Central Management Support, as Francisco mentioned earlier this week in his presentation, and they administer a variety of state and federal grant programs designed to expand access to health care for rural and underserved populations across the state of North Carolina. Next, we'll provide an overview of their budget. This slide looks similar to the one you just saw for DCD in Luke's presentation. Unlike most other divisions, the Office of Rural Health typically relies more heavily on net general fund appropriations, which mainly fund the Community Health Grant Program, which I'll touch on in a little bit. You can see there in the last biennium that both receipts and total requirements did increase for the office, and that's due to an additional $70 million that the office was appropriated from the ARPA Temporary Savings Fund, which we've also heard about in prior presentations this week. Those funds were used to expand the state's student loan repayment program and to also expand telehealth services in rural parts of the state, and I will touch more on both of those later in the presentation. But for now, it's just important to know that since those funds were non-recurring, they will not show up in the office's base budget for the 2025-27 fiscal biennium. There's also an increase in net general fund appropriations for the office for the current biennium, and that's mostly due to some directed grants that flow through the office, and they also will not show up in the base budget for the upcoming biennium. This slide breaks down the requirements by purpose for the Office of Rural Health. And again, unsurprisingly, like most other divisions, most of their total budget, almost 90%, does go toward aid and public assistance. They currently have 42.5 FTEs with about a 7% vacancy rate, which is significantly lower than the state average and the department's vacancy rate as a whole. This slide breaks down their total requirements by program area. About half is for rural practice recruitment and incentives. Again, the office received an additional non-recurring appropriation from the ARPA Temporary Savings Fund to expand the North Carolina loan repayment program, and that accounts for the increase in the requirements for their budget. The next largest amount is for rural health infrastructure, which includes grant programs for safety net providers. And telehealth also accounts for a significant portion of the requirements for this fiscal year, again, due to those ARPA temporary savings funds that were budgeted to expand telehealth infrastructure in rural North Carolina communities. Looking at the net general fund appropriations by program tells a bit of a different story. As I noted earlier, typically the office's budget is majority net general fund supported, but the infusion of the ARPA temporary savings funds receipts in the budget kind of flipped that around for the current biennium. When we take the receipts out of the equation, most of the net appropriation is accounted for under the rural health infrastructure programs. We can see that rural practice recruitment incentives receives just under $5 million from the net general fund appropriation. And I'll also note that in this slide, the net general fund telehealth funds shown are exclusively for the telepsychiatry program that the office administers, known as NC STEP, which I will say more about in a few slides. Next, we'll provide a high-level overview of select Office of Rural Health programs, and we'll start with their provider recruitment and incentive section. Placement Services works to recruit and retain primary care providers, dental professionals, and behavioral health providers to the rural and underserved areas of the state. This section identifies areas of the state that are experiencing healthcare shortages, and then they work with providers and rural communities to make compatible matches. They also administer provider incentive programs available to providers who agree to work in primary care settings in rural and underserved communities. And this slide shows information on 2 state-funded programs. The first one, which I've mentioned already, is the North Carolina Loan Repayment Program. This program provides loan repayment to doctors, dentists, and other advanced practice providers. The maximum award is $100,000 for a doctor or a dentist and $60,000 for nurse practitioners, physician's assistants, or dental hygienists in exchange for a 4-year work commitment. There are currently 140 active contracts under this state-funded program. The High Needs Service Bonus offers taxable cash bonuses under similar terms to qualifying providers who do not have student debt. And there are 97 active contracts under this program. As I've mentioned, the 2023 budget used $50 million from the ARPA Temporary Savings Fund to expand the North Carolina loan repayment program and to establish new recruitment incentives for primary care physicians, behavioral health care providers, and nurses. And I will touch on those details in a little bit. The next area I'll highlight is the Rural Health Infrastructure section, which provides support for the operations of community-based primary care health clinics sites across the state. ORH administers grant programs, provides technical assistance, and provides training to state-designated rural health centers, rural health clinics, and safety net organizations. ORH defines a state-designated rural health center as a healthcare safety net organization that is a 501c3 nonprofit, community-owned organization with an active board that has its primary mission to provide primary healthcare services to those residing in its community. They must be located within communities that are both rural and underserved and must currently be delivering primary healthcare services. 2 state-funded grant programs administered by the Office of Rural Health are highlighted on this slide. The first one is the Community Health Grant Program, which receives $14.8 million recurring from the Net General Fund. The purpose of this program is to increase access to preventive and primary care services for medically vulnerable patients in primary care locations, to establish primary care safety net services in counties where no services currently exist, to create new services or augment existing primary care and preventive medical services, and to increase capacity to serve low-income patients by enhancing or replacing facilities, equipment, or technology. Eligible organizations include federally qualified health centers, state-designated rural health centers, free and charitable clinics, public health departments, and school-based health centers. This is a 3-year grant program with a maximum award of $150,000 a year, and there are currently 102 grantees. The next program is the Rural Health Center program, and this receives just under $3 million recurring from the general fund. The purpose of this program is to improve the ability to serve underserved populations who would otherwise be unable to access needed primary care services. Recipients must be designated as a state-designated rural health center in order to receive funds from this program. There is currently no award cap, and there are 22 grantees receiving funds. The funds are awarded for 1 year, but may be renewed for 2 or 3 years, and they reimburse providers for providing care, improving quality, and for operations and infrastructure. As mentioned earlier, the Office of Rural Health also administers the North Carolina statewide telepsychiatry program, known as NC-STEP. This program receives a $1.8 million recurring appropriation, and it was established in 2013 to expand access to mental health services in rural and underserved parts of the state in order to prevent unnecessary hospitalizations. The program provides timely psychiatric assessment via video and audio conference to persons at emergency departments and community-based clinics presenting with an acute behavioral crisis. The Office of Rural Health has an agreement with the Eastern Carolina University Center for Telepsychiatry and E-Behavioral Health, who implements the service into enrolled sites and administers the operations. ORH provides oversight over the program, and the funds are provided for equipment and technical support to the enrolled sites. As of June 30th, 2024, there were a total of 50 enrolled sites, 28 hospitals, and 22 community-based settings. Over the life of the program, there have been over 63,000 telepsychiatry assessments conducted in hospitals, with over 10,000 inpatient admissions prevented as a result. This slide touches on a few other programs under the office. The first one is the Medication Assistance Program, And under this program, facilities such as rural health centers, federally qualified health centers, and community and faith-based organizations receive grant funds to fund licenses for the Pharmacy Connection, which is software that helps determine free prescription eligibility for patients. These funds can also be used to support the salary for a prescription assistance coordinator who assists patients with identifying their prescription options. Maximum award amount is $28,850. The Office of Rural Health also administers 2 federally funded grant programs designed to support 31 rural hospitals across the state. The Small Rural Hospital Improvement Program helps small rural hospitals, which are defined as having 49 beds or fewer, by assisting them with improvements in value and quality of care. There are 31 small rural hospitals across the state. The Rural Hospital Flexibility Grant Program funds are used to improve the quality of care provided by critical access hospitals, which have 25 beds or fewer, by focusing on improvement of financial, operational, and quality measures. A critical access hospital is a special designation from the Centers for Medicare and Medicaid Services, and there are currently 20 in North Carolina. By definition, they also qualify as small rural hospitals. I'm not going to go through all of the programs covered on this slide, but this map provides a reference for the breadth of services that the Office of Rural Health provides across the state. And as you can see, they have a presence in pretty much every corner of North Carolina. And I will conclude with some highlights of recent legislative actions that impact the Office of Rural Health, starting with the additional ARPA temporary savings funds to expand the North Carolina loan repayment program. The slide shows the breakdown of how the funds were allocated in the 2023 Appropriations Act. As of now, the office has developed guidelines for the expanded programs, and they are finishing hiring staff to administer the additional funds. They plan to start an outreach campaign next month to make sure eligible providers are aware of the availability of these funds. And they plan on going live with the online application system in April of this year. The office is confident that there will be sufficient demand to expend the full $50 million that were appropriated. The other $20 million in ARPA temporary savings funds were appropriated to expand telehealth infrastructure across rural parts of North Carolina. This program provides grants capped at $250,000 to rural providers for equipment, high-speed internet access, and other infrastructure needed to establish telehealth services. The office completed a first wave of applications last fall, which yielded 34 recipients for a total of $7.4 million. The second wave of applications window closed January 31st of this year, and they expect to announce awards next month. The office plans to post additional requests for applications as needed until the funds are fully obligated and spent. And that completes my presentation this morning. Happy to take questions.
Awesome. Thank you so much. I just want to take a quick note that we're going to adjourn at 9:55 because we have Senate rules at 10. So I know we need to get there. But that being said, I'm going to start with, I guess, Senator Sari and ask you if you have any questions.
Thank you. This is on child care. With the stabilization grants and block grants that we funded a little bit of the time following COVID, how many facilities are currently reliant on those across the state of North Carolina? And is there some type of consistent factor, distinguishing category of those facilities that that we could isolate compared to others?
Go ahead. Thank you.
Thank you, Madam Chair. Yeah, Mr. Chair, great question. I I know we have that data. There's a dashboard. I don't have it off the top of my head. I don't know if Director Weatherspoon has that. If not, I can get that to you today. I know we have the number that's available, or I'm sorry, the number of facilities that are receiving that. As far as a distinguishing characteristic, I would say that it's the private facilities are eligible. So if you're a child care facility at like a Head Start, a federal facility, for example, typically these grants have been for the private facilities. And again, I'll defer. I don't know if Director Weatherspoon has that number off the top of her head.
I do. So for
Director Weatherspoon, if you could also remember to introduce yourself. Thank you.
Absolutely. I am Candace Witherspoon, Acting Division Director for Child Development and Early Education. And as of February, the most recent payment was received by 3,731 providers.
Thank you. Follow up, Senator Sari.
Is there a, thank you, Madam Chair. Yes, follow up and probably to the director. What's the average amount that each of those facilities is receiving?
Very similar to those to the subsidy where there's so many different rates because it's built on so many different factors. I don't know that I can give you an accurate average. It's going to depend on how many students they have, how many teachers they have. Are they part-time? Are they full-time? What county they're in? There's a formula. So I don't think it'd be fair to give you an average.
One more follow-up.
Go ahead.
Could you, Director, could you walk briefly through the formula about how that's determined?
Let me answer.
I can follow up and share that information. It's a very complex formula, so I'd just rather follow up and give you that.
That would be excellent. If you could share that information with the rest of the Joint Appropriations Committee, that would be appreciated. I think those are good questions to understand better the people being served. And do you have any other questions, Senator Sari? That was a good one.
Thank you, Madam Chair.
All right, Senator Bergen, do you have any questions?
Thank you, Madam Chairman. You'd be disappointed if I didn't have a series of questions.
I would fall down. I would fall out. I have to call EMS.
Thank you so much. And folks, this is just really interesting and a big thing that's coming up the end of March. We're going to have to deal with something. Can I just run through some statistics that I would love for you all to get and supply to everybody so everybody can see the scope of this? We had a report earlier, but I'd like to have your report, I guess, from the department. Total number of children in licensed childcare in the state. Total number of children in unlicensed childcare in the state. An estimate of how many of those are with either immediate relatives or one-offs, friends, neighbors. The total number of child care centers that have closed in the last 12 months. Well, a total and then a total. Total child care centers, total closed in the last 12 months. And then any estimates that you all have on potential closures, because we've heard different numbers. We've heard as many as 70 are going to close if we don't do something about ongoing support after March. So I guess just any data that you can give us so that we have something to be talking to people about. Also, Senator Sari already mentioned average wage and the compensation grants and everything, but any data, as I said, that you have about child care right now, I think all of us are real interested in seeing that. So that would be very helpful. And then if I could switch gears and talk a minute about rural health, that's a lot of people's primary care, and I think it's real important. And maybe does somebody have some information about rural health versus the FQHCs, the federally qualified health centers? I'd like to see some comparison of the overlap of those. I've got one in Harnett County that is not functioning properly. Some of you have heard me talk about this, and it's been in the paper. And I want to make sure that we're looking at both of those, because both of those are helping the most needy people in our communities. And when they fail, those people end up in our emergency rooms, which becomes the most expensive care they can get. So I'd love for you all to provide us, all of us, any data that you can. And I know we've got a doctor here that's very concerned about this. He and I have been talking about some things, and we need his wise counsel on how to get care to people. Well, two doctors on here. I keep forgetting that our chair up here too, and two doctors. I was looking at Dr. Campbell because he and I were just talking this morning. But two doctors that are very concerned about health care and primary care to do that. Thank you, Madam Chairman.
Thank you. Does anybody from DHHS want to address that oral health question?
Good morning. Thank you for the question. Deputy Secretary Farrington with the Office of the Secretary. We will gather the information. Can you just offer a clarification, Senator Bergen? Are you looking for the number of community health centers that are in operation, the number of people they're serving? Can you clarify?
Madam Chair.
Go ahead.
Thank you, Madam Chair. Yes, ma'am. I would like to we've got the map, and I was just looking over the map trying to figure that out. I just want to just take everything off of that map except the rural health centers, and then put the rural health centers on and the FQHCs on it. So I think there's 170 something FQHCs in the state. I want to see a comparison of those, and because I think we need to coordinate with our federal friends to make sure those things are all working properly, and we're not just duplicating and in my case having a failure. Thank you.
Thank you. Representative Potts, do you have questions? Okay. I know Representative Reeder does.
So, Senator Bergen, you took half my question, so I only have a three-part subset questions. Now, the one question really is about the redetermination of the eligibility for the child care subsidies. I know we heard in the Medicaid about how those eligibility is determined, and I was just wondering if you could talk a little bit about how that's done. Is it an ongoing, is it an annual? What's that process look like?
Anybody answer? Go ahead.
Yeah, thanks, Madam Chair. Good question, Representative Reeder. So the redetermination, the standards on that are generally, in my understanding, set by the federal government with the CCDF. I believe that we redetermine every 12 months. I'm looking at Director Witherspoon. This is done at the local Division of Social Services level. I think that if you want any details beyond that, I would probably better off deferring to Director Witherspoon.
Anybody from DHHS want to elaborate?
Good morning, Candace Witherspoon again. I believe that Luke has answered all of the questions. Are there any additional questions that I can support?
Follow up?
Follow up?
Is the determination made sort of at the start of the school year? Is it done as on a rolling basis? Again, just talking through that, because we know that people's life circumstance changes throughout the course of the year. And if you were on a subsidy and then you somehow won the lottery, would you still be eligible for the next 12 months? Thank you.
Susan Osborne, Deputy Secretary, DHHS. So Luke is correct. There are federal guidelines about reporting and also part of North Carolina policy. So you do have to report a change. If you become unemployed, there are some federal requirements about how many months you can receive while you're attempting to find a job, but change in circumstance is required for reporting. Things like winning the lottery or becoming unemployed.
Last follow-up, I promise.
Follow up?
We heard that on the Medicaid eligibility for adults that some of the local agencies were well behind. Are the local agencies keeping up with those redeterminations, or are they, and I know there might be a federal law, but sometimes people don't meet all those requirements. So I'm just wondering what accountability the local agencies have for doing that.
Anyone? Ms. Osborne?
Yes, Susan Osborne, DHHS. They're up to date. The voucher is not issued unless the redetermination is done. So those are kept up to date.
All right, Representative White. All right. And I do not have my glasses on, so I apologize if I got this wrong, but it looks like Representative Servania has a question.
Thank you, Chair Gailey. I like to ask, I'm inspired by Senator Bergen, but I'm going to try to make it concise. We often hear from providers that there's delays in receiving their reimbursement. Is this data collected? And I would like to know, as a springboard from Senator Bergen's question of what he asked, the timeliness of reimbursement for all those who have submitted one. Do you collect that information, and do you know it right offhand right now?
Anybody who is qualified to answer?
Candace Witherspoon, DHHS. To clarify, when you're talking about reimbursement, are you talking about subsidy reimbursements?
Yes, in childcare, yes, ma'am.
Okay, so, can I keep going? Subsidy reimbursements are provided. There should not be a delay. Those, when payroll or rosters are submitted on the 5th of the month, those pay is documented or shared within 10 to 15 days. The only time that it would be delayed is if rosters are submitted late, not by the 5th of the month.
Thank you. Follow-up, Chair. It was mentioned that a market rate study has been done of late. It is harrowing that we're paying rates off a market rate study of 2021 and 2025. So when will the rates be updated from the current data that was found?
Anybody? Go ahead.
Thanks. Thank you. Representative Servania, the rates will be updated. It takes an act of legislation from the General Assembly, so would be up to the General Assembly.
Thank you. And one last follow-up, Chair.
Follow-up.
It was mentioned in the beginning of the presentation there was an underspending in child care subsidies last year. What was that amount? And what implication does that have in this next biennium?
Go ahead.
Thank you. Again, Representative Servania, thank you. The amount was of this is state net general fund was $32 million. I will note that last year the wait list was extremely low. Really the underspending was because at a high level, I would say the underspending was because there were still federal COVID relief funds that we're able to use in the child care subsidy system. In the current fiscal year, most of those have gone away. Most of the federal funds have expired, been spent. So I wouldn't expect to see the same level of underspending in the current fiscal year, and I think that's reflected in the wait list creeping up.
Representative Campbell, did you have questions? I'm just going to work my way around the room.
Thank you, Madam Chair. Just 2 requests for information. Y'all, if you have it today, great. If you need to get it to me offline. And thank you, Rural Health. Thank you for everything you guys do. Close to my heart. First request for information at the Hunt Institute gathering. I may have heard this wrong. I was going to see if anyone had the official numerator denominator definition of a child care desert. And then the second thing is just an invitation for collaboration. I would love to have the opportunity to sit down with you guys about provider recruitment to rural health care areas in terms of, I love loan repayments. Please understand, I love it like Peter loved the Lord. I benefited from that. I also want to see about, could we expand that to retention efforts, things that help these providers grow roots in these communities so they're not just marking time till their loan is repaid and they go somewhere else. I'd like to focus on the longevity. Anyone who has information or would like to collaborate, please contact me. And that's all. Thank you, Madam Chairman.
Does anybody want to tackle the definition of child care desert question? Anybody qualified to answer that? Go ahead.
I will follow up and give you the specific mathematical equation. Just in just layman's terms, it is when there are more children that need care than spots that are available. And we are identified in North Carolina as 44% of our North Carolinians live in a community that is identified as a child care desert.
Follow up?
Yeah, I understand. What I heard in the Hunt Institute was that the calculation was the number of children 5 and younger, if that was greater than the number of child care spots available, that would be considered a desert, and that seems like a very flawed definition to me as to the percentage of children that would be in that population that do not need child care. So, thank you.
Thank you. Is it Representative Honeycutt? Is that right? I'm sorry, I can't see your name tag. I don't have my glasses on.
No worries, John Almond.
Almond, I'm sorry.
Thank you, Madam
Representative
Chair.
Almond, go ahead.
Just curious when the child care subsidy began.
Anybody want to answer that? Wait.
Thanks, Representative. When the state's program for subsidized childcare vouchers began, I don't have a year. I don't know if Director Witherspoon knows. It's at least in the multiple decades. It's not been a recent thing. I'm happy to try to get that answer to you.
Follow up?
I did. So we thank you, Madam Chair. So we had grants paying that allowed for people to pay their rent through January of 23. And then we also had grants that was paying for labor at these establishments. So just curious. And then we were also funding people who couldn't afford to go to these facilities as well. So I would think that the child care centers probably should have some retained funds, I would think, since majority of your expenses were taken care of for the last few years.
Go ahead.
Thanks, Representative. Yeah, I don't have. We don't have any data as are private child care centers on, savings or anything like that. The only clarification I would mention is the compensation grants. We're paying for not supposed to cover the entire labor cost, but a portion. I think it worked out to maybe a couple dollars an hour for a 5-star facility for a full-time employee. But yeah, the fixed cost grants could go towards anything, whether it be rent or reimbursing parents for tuition or most kind of recurring costs of a provider. But unfortunately, I don't have data on, if anyone has saved that or what the general need of the businesses is.
Thank you. You have any more follow-up? Representative Liu?
Thank you, Madam Chair. This is a question for Susie. If you could help me to break down the folks who apply for loan repayment program and the grants program, are there more primary doctors or doctors in certain specialties? Do we struggle in keeping primary doctors or doctors in certain specialties? Because I know even in the urban counties, and folks have a very hard time scheduling with rheumatologists or specialists they want to see. But I'm just wondering, what's a greater need? Is that primary doctors or specialists? If specialists, what specialties are we really desperately need recruiting or keeping in the rural counties?
Ms. Camilleri?
Thank you, Madam Chair, and thank you for the question. I don't have a breakdown of what the need is for primary care versus specialty care. I will note that on this slide, the types of care that the ARPA funds can go to was expanded beyond, the dentists and the doctors and the primary care providers. And in terms of retention, and going back to an earlier question about retention, I know that is something that the office is working on and trying to solve that tricky problem. And one of the ways that they do that is by offering a second loan to some of these providers. If they still have outstanding debt after their first 4-year commitment, they can get another loan for another 4-year commitment. And then, being in a community for 8 years, hopefully talking about growing roots might lead to a lot of them staying in that community beyond the terms of the loan. But I don't know if the Office of Rural Health staff has any additional information regarding specialty need versus primary need in those areas.
Senator Bergen?
Thank you, Madam Chair. I'll speak to this just a moment because I worked on this bill and we're still working on it. The original plan was for primary care doctors and psychiatrists. We had a shortage in all the rural communities. We had 31 counties that did not have a psychiatrist, and the primary care doctors are just really hard to keep in rural areas. And then we started expanding it because after we started working on the bill, we realized how many areas didn't have PAs, didn't have other practices. Our goal, my goal, is I want to raise that amount from $100,000 to $200,000 because it's working. You can see the number of doctors we've had, and then Co-Chair he just mentioned to me, we also need to look at some other things. Now, I jokingly said when we had meetings about this that we also need to start a matchmaking company, and when these doctors go to rural areas, we need to get them married to local people so they stay in those areas. But there's a lot of truth to that. I've had doctors tell me that when they move to an area and they meet a local person, this is male or female, that they stay there. So, but we've got to get more primary care docs and psychiatrists out of the concentration. I'm just afraid that if we're not careful, all of our health care is going to be concentrated in 4 or 5 areas in the state, and we don't need that. We especially need primary care in local communities. Thank you, Madam Chair.
We need your creativity, Senator Bergen.
Senator Bergen's going to start the romance task force in rural health.
We'll provide a dating app with each application.
That's a good idea. So, Representative Ryan, did you have some questions?
I did not, Madam Chair. I've spent multiple hours with my constituents at home on DCDEE. I want to thank you for your work and how important that is.
Super. And Senator Blue, I think you might be the only one we haven't heard from. Is there anybody else who's got anything to say? If not, then we'll be adjourned. Thank you.